What up, YouTube? This is your girl Tracy again for I don't know, the 10th time. I don't have that many videos and I don't make them that often, but I did want to give a quick update while I'm over here waiting for my son to be done with his appointment. I wanted to talk to you guys about burn because I am now a burn nurse. Yeah. So the last time I made a video, I was working in ortho-urology, med-surg unit, and I did not like it. I thought it was mostly because I was like, maybe managing care isn't really my thing, and I'm just better with critical care in out situations because I have been an EMT for 10 years. 3 of those years I was, or 2.5 of those years, I was in an emergency department, and maybe for a year, actually even longer if you can count my PRN job. I would do a lot of standby work, because it's like a standby medic. So I was like, maybe that's just my environment, and being anywhere else is not going to work for me. And when I left that hospital, because I really felt like I wasn't learning like I should, there was other stuff that was going on, I was just like, I'm just going to leave, and I'm just not going to do that type of nursing again, but let me just give a different environment a try. And so I applied for a burn ICU RN position, and I got it. So I got it because a friend of mine gave me a letter of recommendation. We worked together at the previous hospital. We both worked in the ER together. She was a nurse at the time. I was still an EMT. And we would talk about leaving that department, or not so much that department, but leaving that hospital, because we really wanted to work with the underserved community, working with people who really need help, who won't be judged because they need help regardless of why they need it. And we both ended up deciding, we wanted to go to county. It was just a dream of both of ours. She left first. She had been a nurse for years, so she had got a position there. She wrote me a letter of recommendation, and that's how I ended up over there. She didn't know the people at the department that I worked at. She gave a letter of recommendation to the person that hired her. They moved that letter of recommendation as well as my resume over to the hiring manager in the burn unit, and then of course I applied for the job because she told me about it after she already wrote the letter of recommendation, and then I got it. So that was great. And I was really happy. I got there. I was a little skeptical because then I found out that before you go straight to the ICU, you have to do so much time as far as their med-surg unit before you can go over to the ICU, because you need to have your foundation. So it's like, okay, I just left in med-surg unit, and I really don't want to do another med-surg unit. Clearly this is not for me. And I'm there, and I'm realizing, okay, first of all, I love this. Okay, when you're a burn nurse, you do a whole lot of wound care and dressing, and if anybody knows me, that is right up your girl's alley. Okay, I love it. I love doing dressing changes. I love assessing wounds, looking at wounds. Don't really get disgusted. I don't get grossed out. I mean, sometimes thankfully we wear masks because my face is doing one of this, but my face is looking nasty, and some of it is ew, this is so yucky, but I can't stop. I love it. Even when look, y'all, Dr. Pimple Popper, if you ever see this video, which will probably be never, but if you ever see this video, I would love to come out and do some pimple popping with you. I could just stand by and watch while you're nursing staff and you guys do it, because I just I love it. I'll be watching those videos. I make yucky faces, and then I'm just so satisfied. So I love wounds. I love abscesses. I like the fact that in burns, and a lot of times people get burned and they get blisters, and in burn you actually supposed to cut open those blisters because you don't want that stuff sitting there. Oh yes, I'm just all for it. When I found out, I was like, oh wait, popping those blisters aren't bad. only if you're in a healthcare setting. If you're at home, please don't pop those blisters. You know, you need to be like, you're opening up possibility for infection. And there's more to it. Just be like, you know, an actual wound nurse before you start doing that. But aside from that, or at least in like be like in a healthcare facility, so they can make sure they like clean it and dress it, all that. But I was just like, ooh, yes, I was for it. And so I was really happy about that. So then that's when I learned, oh, for sure. So it wasn't the fact that it was a med surge thing, but it was the fact that like I just wasn't in a learning environment. And I think that was really important to bring up, especially if you're a new nurse and you're working at like a hospital or in a department that you feel like you're not learning like you should, or you know, you're kind of being targeted for certain things no matter what, or the reason why. If it's impeding your learning and your acceleration as being a competent nurse, because I had said from the beginning when I decided to become a nurse, I want to be a competent nurse. If that's becoming a problem and I can't be the type of nurse that I want to be and I need to be and I deserve to be and my patients deserve me to be, then it's definitely time to make a change. And I was really happy that I made that change. Did it come with less pay? Yes, but it came with so much peace of mind and fulfillment in my job description and in my job, and I'm just so satisfied with everything, and I just see it all as a blessing and that God is blessing me. And sometimes people only look at your, like, you know, I'm still getting paid. I'm not getting paid no money. I did take a huge pay cut, but I'm just blessed and I'm just so thankful for it. And so that's really important. So back to being a burn nurse, you guys, let me tell you. So burn med surge, you know, yes, we have to know the rule of 9, because depending on the percentage of the burn, it really determines like if the patient needs to be hospitalized, and also where the burns are located. So like hands and feet, like these are things that you need to like walk around with, to grab things. And so your hands and feet, like burns in those areas are really important to get addressed, because sometimes you don't know how bad a burn is, and sometimes burns can take up to like 3 days before they truly show what stage of burn they are. So it might look like it might be a 1st degree, oh, it's just a little bit, and then you find out, oh no, it's not a 1st degree, it's not a 2nd degree, oh shoot, like that's a 3rd degree burn, when you start seeing certain colorations start showing up. And of course, when you have burns on like the neck, the chest, your face, these are things that account for like respiratory, and you want to make sure that patients, their airway is patent, that their lungs are able to expand, that the constriction of the fact that there's no skin and elasticity, and the skin is not, you know, harboring the patient from getting good breaths in. And also, like, you know, sometimes this all can start blistering up, and that affects the airway too. So it's really important to look for those things, and also be aware of, like, you know, now temperature control is a problem, fluid and electrolyte instability is a problem. So just as nurses, these are just things that we're thinking about. And I'm gonna tell you guys, when I went in for my interview there, like I was like, did all my reviews on burns, and they didn't ask me not one single thing. And I think it's because, like, even though I had worked as a nurse somewhere else, I was still a new grad. I'm still considered a new grad. I just finished, I just graduated nursing school in November. I just got past my NCLEX in February, and I started working in February. So, you know, less than 12 months of working as an RN, you are a new grad. And so I'm still a new grad. So they weren't asking me all these questions because they knew they were going to teach me. And so, you know, and then of course, you know, you learn stuff in school. It's like, why am I going to test you on something that not only did you learn it in school, you passed school, so they, you know, tested you on that stuff there. You passed the NCLEX, so it's not like you're stupid. You just need to be taught how to do this in real life. So it was great. Great experience, great interview, and I'm just really happy to be a burn nurse. I do see myself staying in burn for quite some time. I do want to venture out, see other things in healthcare, and luckily, because my hospital basically has everything in one place. I don't have to go to different hospitals for it. I can actually do it all at my one hospital. But you guys, burn, I just found love for it. And also, like my hospital, we have like the burn med surge, burn ICU step down, and burn ER. And then we have our burn clinics and outpatient clinics. So like, you know, I can do a lot just in burn and move around that way. And then, you know, it's still a full on hospital, so I can go into like our regular emergency department, another different type of ICU, cardiac. It's just so much to do. The only thing I don't want to do is peds, which is unfortunate because part of being in burn med surge is that we also have a peds unit that I'm not allowed to work in right now because I don't have my PALS, but I'm going to be getting my PALS soon, so we'll see how that works out. But I just wanted to give you guys a quick update. Hopefully I can encourage some new nurses, some soon to be graduating nurses, and you guys, don't let anybody make you feel like you're not competent. Don't let anybody shake up your confidence of what you do know, and what you've learned in school, and what you've learned in hands-on experience. So, and if that starts to happen, you know, say something. And if nothing changes, peace out, deuces, move on, like on to the next. There's too much high demand for nurses right now, and not just right now, but all the time. There's always demand for nurses, so you always have options. Don't feel like you have no options for whatever reason. But that's my only updates. Hopefully this can help somebody out.